We're joined now by Dr. Jerome McDonald. He is the Medical Director of Cardiothoracic Surgery at Sentara RMH, and we're here to talk about aortic stenosis. First of all, what is it?
Well, aortic stenosis is a blockage of the valve of your heart called the aortic valve, and it's usually what occurs is calcium builds up on the valve leaflets, and normally they're pliable and open freely, and when calcium builds up, they become blocked, which puts, much like stepping on a garden hose, it puts pressure behind the valve and causes your heart to work harder.
Okay. Now, what are the symptoms of aortic stenosis? Does somebody know, hey, that's what I've got?
Many people have a murmur for many years and maybe neglect it for a while, but largely when you actually form symptoms, it's chest pain, much like when you're having coronary disease, like typically we bypass, or it can have what's called syncope, which is where you pass out. And the last one, which is probably the most common, is shortness of breath. And that's because the heart's working very hard, it gets thick, and blood backs up into your lungs and causes you to be short of breath.
And in a few cases, you told me people just die right away from it. So this shouldn't be ignored if you're thinking that you might have a problem.
Certainly you shouldn't ignore it. The survival when you have severe aortic stenosis is very abysmal. It's 8 months or 9 months without any treatment. And though there's no medicine that's available for it, there's a great option, which is surgery. And by replacing the valve, you can have a significant lifespan improvement.
So that's the treatment, is surgery?
Surgery is the only treatment for isolated aortic valve disease, yes.
And what types of surgery are done? Is it all one type, or are there options?
As we talked about, your father actually had a big open incision to work on the heart, and that's still used in many cases when multiple procedures are necessary. But when you're just looking at valve surgery, especially aortic valve surgery, we can do a small 2-inch incision called minimally invasive aortic valve surgery.
2 inches?
2 inches, which is actually the width of 2 thumbs. I mean, obviously thumbs are slightly different on different people, but a typical 2 inches is 2 thumb widths. And so with that width, we can make an incision over here and go between the ribs without splitting the breastbone and get in there and replace the valve.
And that's it? Just you can do it with a minimal small?
Yeah, it's the same actual valve, same procedure in many ways in terms of taking the valve out and putting a new one in, but it can be done just because that's the location. It can be done with a small hole. Okay.
Now, why is this minimally invasive surgery such a valuable option?
Well, one is especially people that are working or need their arms for significant mobility, you have no real limitation of your arm function after surgery, whereas when you crack the breastbone, it can be up to 3 months for people that are heavy lifters in their job. Likewise, there's less bleeding, less infection, less pain, and many times the most important aspect of this is for the somewhat elderly population. It actually promotes their acceptance of the procedure, and heart surgery can be very scary for people. Mm-hmm. And if you can get people that would have a dramatic improvement in quality of life and lifespan, if you can get them to accept it, mm-hmm. That's a critical component.
And this is, I think, one of the most important points that you told me is that some people do not take action even though they have symptoms because they just figure this is part of aging, and that's not the case.
No, if you look at patients that are, I'll give you an example, a large group that were 83 in a study. With surgery, they lived an average of 10 years, and if you look at several studies, most people assume the same lifespan as their peer group, as if they never had aortic stenosis. And without surgery, as I mentioned a little bit earlier, it's about 8 to 9 month lifespan. So you're talking about a dramatic difference in lifespan. And frankly, one of the biggest concerns of the somewhat elderly population is being a burden to their family. And you largely will become a burden to your family as you become more short of breath and unable to do your daily living and needing oxygen if you don't have something done. So we're really lucky to have an excellent technique to be able to treat aortic stenosis, and now we can do it with a somewhat smaller incision and better postoperative recovery.
Excellent. Well, Dr. Jerome McDonald, the Medical Director of Cardiothoracic Surgery at Sentara RMH, thanks for joining us.
Thank you.